we go. All right. Hi, everybody. Good morning. Welcome to our second webinar in our series for our Person First investigation and legal analysis of people with intellectual and developmental disabilities in New Jersey's nursing homes. I'm Jill Hogel. I am the director of our investigations and monitoring work at Disability Rights New Jersey. And Bren Pramanik is on here, who will be my wing person throughout this, manning the chat, letting you all in. And Bren, if you want to take care of the housekeeping.
Yes, of course. So as Jill mentioned, everybody, the webinar is going to be recorded. There are closed captions available as well, and there will be a transcription available. So please remain muted throughout the webinar, and please hold all questions until the end. If you would like to drop questions into the chat, you certainly can do that. And then after the end of the presentation, please feel free to also raise your hand, take yourself off mute if you want to ask questions. But we would just ask that any questions be held until the end.
And that is because I am very easily distracted. And if I do the questions throughout, I will completely lose my train of thought, and we'll end up being here till this afternoon taking care of this. So we did introductions already. So I am going to start off just with, a brief background about what a protection and advocacy is for anyone on this who doesn't already know. But Disability Rights New Jersey is New Jersey's designated protection and advocacy agency. The protection and advocacy system came about in the 70s after an investigative journalist, Geraldo Rivera, had exposed some really horrific conditions in a state school in New York called Willowbrook. This was a state school for individuals with intellectual and developmental disabilities. And because of that, that investigative journalism, Congress acted, and they acted by establishing the Developmental Disabilities and Bill of Rights Act. So what that act did, that is our founding legislation, as we refer to it, it established the protection and advocacy system. So every state has a designated protection and advocacy agency that has the authority to do a lot of things, really, really broad authorities. Access authority, which I'm going to get into in a little bit more detail, and legal authority to represent the interests of people with intellectual and developmental disabilities. And then later on, different pieces of legislation gave us the ability to act on behalf of pretty much anybody with a disability in the state of New Jersey. The act also established the councils on developmental the New Jersey Councils on Developmental Disabilities and the Centers for Excellence, which in New Jersey is the Boggs Center. So as I mentioned, our access authority to be able to monitor and investigate allegations of abuse and neglect is really, what makes the protection and advocacy system unique. So as a result of that Willowbrook expose and the legislation, the intent of having a protection and advocacy agency is to give that agency the authority to monitor. So going into facilities where people with disabilities are, to make sure that they're not subject to abuse and neglect, making sure that their rights are protected, that they're living in, safe and humane conditions. Also just being able to talk with individuals who are in a variety of settings, to give them information about the things that we do as the protection and advocacy agency. Our access authority also extends to records. So beyond just facilities and individuals, In certain circumstances, we can access records of individuals with consent, sometimes without consent, depending on the specific situation and which fund is covering those services. So as I mentioned, our monitoring is boots on the ground. So we can go into facilities, any place where a person with a disability lives, works, or receives services. And we don't have to have an allegation of abuse and neglect to monitor. We can just go in for any reason that we choose. Sometimes it is because of a complaint, but sometimes it's just because maybe there's a setting that, we haven't visited before, that we think, the individuals there would benefit from our services, and we want to, do some outreach and let people know that we exist and how they can contact us. That access, by the way, for monitoring is can be unannounced, so we don't have to announce that we're coming. Sometimes we do, sometimes we don't. And it's also unaccompanied, which means that we can, go to any place within that facility where the individuals with disabilities can go to. So, the day rooms or the bedrooms or, any place that the individuals have access to, we would have access to. Now, our investigations authority is slightly different. We can conduct an investigation when we receive any allegation from any source of abuse or neglect. So that could be the individual themselves calling us. It could be a family member or a guardian. It could be a staff person. It could be an anonymous source, be a media report or a news article. So we can accept an allegation through, any source. And for investigations, we can interview individuals, not only the individual for whom, we receive the allegation, but any individual who we believe might have knowledge of that incident or allegation, including staff persons, other individuals. And also, again, for investigations, that's unaccompanied access, and occasionally we'll use our records access. Not occasionally, but pretty often we'll use our records access when we're trying to investigate an allegation of abuse or neglect. So with all that background, I'm here specifically to talk about this investigation, our investigation behalf of individuals with intellectual and developmental disabilities in nursing homes. And so really the origins of that started even before COVID, through some of this monitoring work that we've done, and through, individual allegations or investigations that we've done even before COVID, we were encountering quite a number of individuals who had intellectual and developmental disabilities in nursing homes, and didn't have a whole lot of information about why they were there or how many people were there. And then COVID, which you'll hear quite often. And then suddenly it was COVID. And as we all know, New Jersey's nursing homes did not fare well at all during the period of COVID. And so this really heightened our concern about individuals with disabilities who are residing in New Jersey's nursing homes, especially in light of what happened during COVID. And one really specific example of that was what happened at Woodland Behavioral Health and Nursing Home, which was formerly called Andover. They were in the news quite a bit during COVID, and I will mention, we were not for a period of time in person, so we were not conducting on-site investigations or monitoring during the period of COVID when things were on lockdown. We did a bit of virtual monitoring, via video, via telephone access, but we were not physically on site in many locations during COVID. However, because of the really, really disturbing news reports that were coming out about this specific facility, Andover, we did a little bit of investigating into that, and wrote to the administration, wrote to the governor about our concerns in that facility, and got some data back from just that one specific facility at that time, where we learned that between the two settings, there was Andover 1 and Andover 2, that they had 47 residents with intellectual and developmental disabilities. So in addition to 305 individuals with mental health disabilities and 17 with traumatic brain injury, all in all, across all of those disabilities, they had over 50 individuals who died in their facilities during COVID, which only really heightened our concerns about people with disabilities, and specifically intellectual and developmental disabilities residing in nursing homes. And so that pretty much gave us, our probable cause to look into this further. So when we initiated this investigation, as I mentioned, we do have the authority as the Protection and Advocacy to investigate incidents of abuse and neglect if the incident is reported to us or if we have probable cause. So the definitions we use of abuse and neglect can also encompass violations of individuals with disabilities' civil rights. And P&As can typically, in our discretion, determine that a violation of an individual's legal rights can amount to abuse. So through our lens of our mission to protect the legal and human rights of individuals with intellectual and developmental disabilities, including their rights under the Olmstead decision, Title II of the ADA, and nursing home specific laws like the PASAR, the pre-admission screening and resident review. That is how we determined that we had the probable cause to believe that abuse and neglect was occurring. So we had asked, prior to initiating this investigation, for data on the numbers of individuals who lived across all of New Jersey's nursing homes who had intellectual and developmental disabilities. We asked for that information from the Medicaid agencies. We asked for information from DDD, and DDD had produced a list for us of 587 people. Originally was the list that we have received. We asked for the names of the individuals and the locations where they were. After reviewing that list, we had kind of whittled the names down to 525, removing some of the names where DDD didn't know where the person lived, and some of the names included individuals who were in developmental centers and not nursing homes. So we kind of put those names to the side and left us with a list of about 525 DDD identified. And so these were individuals who either had previously been receiving services from the Division of Developmental Disabilities, or had at some point had contact with the division, maybe had, through an intake. So it wasn't necessarily people who were currently receiving services from DDD, but who at some point had touched the division. And so that's how they generated the list. So with that list, kind of our breaking down our methodology a bit, we conducted site visits to specific nursing homes, and we focused on the nursing homes that had the highest number of individuals, but we also wanted to make sure that we covered the whole state. So we made sure that we visited at least one nursing home in all 21 counties. And so during these site visits, we collected lots of observations about the facility itself, and also conducted interviews with the individuals who were there that were on our list, but then also, other individuals who may have approached us or who were identified to us by facility staff, some of whom facility staff identified as a person with an intellectual or developmental disabilities, but maybe wasn't, originally on our list. We interviewed the staff and the administration, and we conducted our interviews with the residents, for those who were able to speak with us. For those who were not able to speak with us and had a legal guardian, we requested contact information for the guardian so that we could do outreach to them as well. We used a questionnaire that we came up with beforehand, so that we were asking the residents kind of the same questions, basically about, how they felt about where they lived, where they may have lived before they were in the nursing home, and questions kind of about their daily life and their schedule and routine in the nursing home. We asked for records, including the PASARs and face sheets, which typically gave information about where the individual may have been before they were admitted to the nursing home. Also occasionally had contact information for a guardian if a guardian existed. And where individuals expressed to us that they did not want to live in the nursing home anymore, wanted to live somewhere else, we made referrals to our institutional rights team internally to provide representation, legal representation, to those individuals who identified to us that they did not want to live in the nursing home any longer. We did a lot of outreach to guardians. So we made contact, or attempted to make contact with any guardians where we were given their contact information from the facility. We also we put a public survey on our website. We shared that pretty widely with our sister agencies, the Council on Developmental Disabilities and the Boggs Center, in order to really try to get as much feedback also from guardians. Since we were interviewing residents, we wanted feedback from guardians as well. And that included the Bureau of Guardianship Services and the Office of the Public Guardian, who a number of individuals had guardians in one of those two state guardianship agencies. So we also interviewed a number of stakeholders, including advocacy groups, trade organizations, the Ombudsman for Intellectual and Developmental Disabilities, representatives from the Long-Term Care Ombudsman's Office, the I Choose Home program, AARP, Leading Age of New Jersey and Delaware, which is one of the trade organizations. And as I mentioned, BGS and OPG, we interviewed a number of guardians in those agencies. So after we did all of that, that really led us to our key finding number one. And I'm really only going to focus on our key finding number one, even though, if you've read a report or taken a look at our report, there's a number of key findings that we had there, but you're going to have to join us for the other webinars to hear information about some of those other key findings. Number one key finding really had to do with the data, or lack thereof, I should say. We determined that the state of New Jersey failed to collect and maintain complete, consistent, and accurate data regarding the number of people with intellectual and developmental disabilities residing in nursing homes, both before COVID, during COVID, and since. And, we had received numbers from a variety of different sources. Advocates even outside of Disability Rights New Jersey had requested through the Open Public Records Act information and shared with us. Medicaid provided numbers at the MAC meetings, the Medical Assistance Advisory Council, and obviously the list that we received from DDD. And then also the Centers for Medicaid Services maintains a minimum data set. So that's the MDS. And so that's information that the nursing homes required to report back to the Centers for Medicaid Services, and that those numbers are publicly available on their website. And so looking at the MDS frequency data, which listed the numbers of individuals with developmental disabilities in the thousands, so roughly 2,000 plus, and then the discrepancy of anywhere between 500 and 600 people reported by DDD, and at the MAC, there was no one consistent number, which really led us to believe that no one had a really accurate count of the numbers of people in New Jersey's nursing homes with intellectual and developmental disabilities. And so I wanted to just kind of review what our recommendations were just around this key finding. Again, really just focusing on this one key finding, that New Jersey should develop a cross-agency centralized data storage system to maintain accurate data regarding people with intellectual and developmental disabilities and mental health disabilities who are living in New Jersey's nursing homes. We believe that New Jersey should collect and aggregate the existing data for demographic information, age, race, ethnicity, disability, languages, sexual orientation, or gender identity, that would help examine any implicit bias in the long-term care service system and help policymakers as they build future opportunities in home and community-based settings. Believe that New Jersey should maintain a public dashboard that includes the aggregate, but not personally identifying information, akin to the Department of Human Services family care dashboards. And then New Jersey should adopt and implement PASAR quality monitoring and quality improvement indicators that are critical for promoting the success of the state's PASAR program. I'm not going to talk in depth about the PASAR issues. That I think is webinar 3. So if that is, your area of interest, please join us for webinar 3 or 4 maybe, or both. That will really get into that in much more depth. But those are recommendations. And I know I went through that, pretty generally. Wanted to give just really a broad-based view of how we initiated our investigation and why we initiated our investigation, how we actually conducted the investigation, and what kind of we found at least one of our key findings as a result. So I wanted to make sure I now gave plenty of time for people who had questions or wanted more specifics. So I am happy to open it up to questions at this point, if we have any in the chat.
So there was a question, Jill, just about face sheets.
Sure.
And I had just said that they are completed by the nursing facility, that the nursing facilities keep those on file, and it has a different a host of different kind of identifying information about diagnoses, that kind of thing contained within them. It looks like there's also a question about who determined that specialized services were not needed for those individuals with IDD. And we will speak more about specialized services, like Jill had mentioned, at the webinar next week on the 23rd at 10 a.m. But it's kind of a complicated answer in terms of specialized services, but if somebody if they are supposed to receive a level 2 evaluation, the level 2 evaluation is completed by either the Division of Mental Health and Addiction Services or DDD, the Division of Developmental Disabilities. It's not necessarily completed by people at those agencies, but that's kind of the long answer. So there's a variety of reasons why it might be determined that somebody's not does not need specialized services.
Right. But I think for individuals who are identified through that PASSAR process as having an intellectual and developmental disability, that would be DDD's responsibility to make that determination. And I believe that typically the regional nurses are part of that process.
Yes. And that specialized services determination is made at the level 2 evaluation. So sometimes people don't always have a level 2 evaluation due to categorical determinations, and we'll get, a lot more into that next week. And then there's also, it says PASSAR 2 is suspended during COVID, and it hasn't been reinstated. Yes, there are supposed to be level 2 evaluations completed at this point. Are there any other questions that people have? Again, if you want to drop them in the chat, I'm happy to read them aloud, or if you want to unmute yourself, certainly you can ask a question as well.
Yeah, I mean, I think we have a small enough group that if you wanted to unmute yourself to ask a question or raise your hand, calling you, should feel free to do that.
So there's one question, Jill. It says, is specialized services another term for active treatment in the DCs as per Appendix J?
I believe that they are not the same thing. I'm not going to be able to, off the top of my head, give you the definition of it, but no, active treatment is not the same thing as specialized services. And Adrian, you have your hand up. So
yeah, so
you probably know this.
Yeah, specialized services is so there's specialized services that would require for mental health disabilities 24/7, so really inpatient treatment in a really in a psychiatric hospital. Sorry, Adrian, you had your hand up.
Oh yes. So I'm there, and as I think so my name is Adrienne Langlois. I am a staff attorney on the institutional rights team, and I was involved in the investigation and did a lot of the interviews behind this. So I think there's a couple of this is a I think a good question, and it's also like a really complex question, because there's what the federal rules say that like specialized services is supposed to be, and what New Jersey says that they are. New Jersey basically defines specialized services as services that can't be received in a nursing home setting, and that's not what's supposed to happen. Just to give you a little preview of PASSAR. specialized services under the federal rules used to be called active treatment. And I think because there was sort of that confusion, because of the active treatment services that are provided in developmental center in ICFs, they made the change pretty early on. CMS made a change pretty early on to not use the term active treatment, instead use specialized services. And the idea is that specialized services can be provided to people who are in a nursing facility and need additional services that, you know, often are supposed to be waiver-like. They resemble services that you can get in the community, such as day programs, job coaching, things like that. So we'll get more into that. But I think the question is sort of, in New Jersey, yes, they're essentially the same thing, but it's not how it's supposed to be at all under the federal rules.
Thank you, Adrian.
So it looks like there's a request for links to the sources of information on this. So a lot of the we do have information contained within the report that kind of speak to this. Again, we'll speak a lot more about specialized services and the PASSAR process next week. And then there's also a plethora of information, more information about this in the endnotes that we have, and we have all kinds of sources as well in the link to the report.
Yeah, absolutely. Everything that I said, any of those numbers that I said, they're all contained with links in endnotes or throughout the report.
So I don't see any other any questions in the chat, Jill, and it doesn't look like anybody else has their hand up. Again, please, if you have any other questions, you can certainly feel free to unmute or drop a question in the chat. And if there aren't any more questions, like we've mentioned a few times, we do. So our next webinar next Monday, the 23rd, is at 10 a.m. And that is going to be speaking to Key Finding 2, which is, again, about the PASSAR process, and that's the pre-admission screening and resident review, which needs to be completed for everybody entering a nursing facility in New Jersey. And that will speak a lot more about the specialized services and, you know, some of the issues with the PASSAR process in New Jersey, like Adrian had mentioned. And then on Halloween, we are going to have our final webinar about Key Finding 3 and some additional recommendations for the paper. And that's going to be with Adrian, who had spoken earlier about specialized services, and then another attorney at DRNJ, Craig Ismaili.
And that is webinar 4.
Yes, webinar 4 about Key Finding 3. Yes.
Just to keep you all on your toes. So,
Okay.
oh, great. I think that is the end. Right. Oh, here we go. We have a fancy QR code for where you can access our report. You can also access our report on our website. So those of you who are asking for links to the information or more specifics, can use that QR code or just go to our website, disabilityrightsnj.org, to take a look at the report, to take a look at the endnotes, for all the information that you need. Here's all of our social media handles. And these webinars, obviously recorded, they will also be up on our website. So if you missed something or wanted to go back and see it again, or missed one of our other webinars, they will all be up on our website as well. And that's that. So want to thank everybody for coming and have a great day.
Thank you very much.
Thank
Thanks, Jill.